Assalamualaikum and a very good morning to all the participants and the host. My name is Intan Diyana and I would like to present my research titled Solute Dispersion in an Unsteady Herschel-Bulkley Flow through an Inclined Stenosed Artery. My research is co-authored by my supervisor, Dr. Nurul Aini Jaafar, and my co-supervisor, Associate Professor Dr. Sharidan Shafi'i. So before I go further into my research, I would like to explain the background of study. So a stenosed artery is an artery that have a stenosis at the arterial wall, as shown in figure 1 here. We can see the comparison between a normal artery and a stenosed artery. So a stenosis is defined as a small obstruction of the blood vessels due to the accumulation of fats, cholesterols, and abnormal tissue growth, and it narrows down the blood vessels. So there are several types of stenosis that is commonly researched by other researchers, such as the cosine stenosis, sine stenosis, overlapping stenosis, and many more. So the formation of stenosis significantly alters the blood flow and lead to the progress of cardiovascular diseases such as heart attack and stroke, as the stenosis continues to grow due to fluid dynamical factors. So certain treatment involves the injection of drug into the stenosed artery, but due to the presence of the stenosis, it affects the behavior of the blood flow and the solute dispersion within the artery. So we want to investigate how the stenosis size affects the drug solute dispersion. So we also consider the inclination of the artery. So in the circulatory system, there are many branches of artery throughout the body with different orientation. The arterial inclination of the stenosed artery should be considered as various vessels in a physiological system have some inclination instead of being horizontal. So the blood flow and the solid dispersion at different artery location is affected by the inclination. As we can see here in the figure 2, that each type of artery have its own inclination. So we have to consider which artery is the best artery for treatment according to its inclination. So the significance of this research is that the theoretical results can give a better understanding on the blood flow and dispersion rate behavior inside an inclined stenosed artery so that it can help predict the effectiveness of a medicine by manipulating the dosage. Second, it provides insights on the effect of stenosis height and arterial inclination on the dispersion behavior inside a stenosed artery after a certain time frame so that doctors can give a more accurate prognosis and decide the suitable treatment for the patient before introducing the medicine into the cardiovascular system. And last, it can help physiologists in recommending appropriate amount of medicine to patients depending on the situation. So the objective of this study is first to formulate the unsteady Herschel-Bulkley, which represents the blood, in a stenosed artery with the presence of inclination. Second is to solve the Herschel-Bulkley constitutive equation and momentum equation by employing the regular perturbation method to obtain blood velocity. And third, to solve the unsteady convective diffusion equation using the derivative series expansion known as generalized dispersion model (GDM) to obtain steady dispersion function. And lastly, to graphically plot and analyze the effect of stenosis height and arterial inclination for both cosine and sine stenosis. Next is a schematic diagram. So we can see in figure 3 here is a schematic diagram for the blood flow through an inclined stenosed artery. We can see that there is a presence of stenosis at the arterial wall here, and within the flow region there exists a two region, which is the outer flow region and the plug flow region. At the plug flow region, blood cells and other materials tend to accumulate here, and the overall artery is inclined to a certain degree theta, and the blood flow movement is along uh, the axis z axis here, and it is affected by the gravity sine theta. So next is the formulation of the problem. So the unsteady blood flow of Herschel-Bulkley through an inclined stenosed artery will be formulated using the unsteady momentum equation in equation 1 here with its boundary condition as shown here. and the Herschel-Bulkley constitutive equation as shown in equation 2 with its boundary condition below here. And we can see that the boundary condition is from 0 until Rz, in which Rz here is the formula for the stenosis, which is given by equation 4 and 5 here. So equation 4 is the formula for the cosine stenosis, and equation 5 is the formula for the sine stenosis. So in the formulation for the solute dispersion within the inclined stenosed artery, we use the unsteady convective diffusion equation as given in equation 3 here, and solve for the dispersion function using the generalized dispersion model GDM method with the boundary condition as shown here. So method of solution. First, we will solve for the velocity. So the momentum and the Herschel-Bulkley constitutive equation are first non-dimensionalized to obtain equation 6 and 7. Next, the series expansion of perturbation method is obtained using the Reynolds number alpha as the small perturbation parameter. Velocity and the shear stress are expanded in perturbation series expansion of this equation here, W and shear stress here. So this equation here is substituted into the equation 6 and 7. And then equating the coefficient of constant and the alpha term, we obtain equation 8, 9, 10, and 11 here. And from there, we can proceed to solve for the velocities using the integration method. Next, we solve for the dispersion function. So firstly, the unsteady convective diffusion equation is non-dimensionalized. To obtain equation 12 here, the obtained velocities are then substituted into the unsteady convective diffusion equation and solve for the dispersion function using the GDM. So Gill and Sankara Subramaniam, 1970, generalized dispersion model assume the solution as in equation 13 here. So from this equation 13 here, we can obtain F1, in which F1 is the dispersion function, which contains the steady dispersion function and the unsteady dispersion function. And from equation 14 here, we can obtain the steady dispersion function equation as in equation 15 here, and then solve for the steady dispersion function using the integration method. So next is the result. So first we like to look at the effect of stenosis height and arterial inclination on the blood velocity. So in figure 4 here, we can see that the increase in stenosis height decreases the blood velocity. The increase in stenosis height reduces the flow region within the artery, and the reduce in the flow region causes the blood to have less space to flow. That's why the velocity reduces. Not to mention the fatty substance deposited at the arterial wall increases the resistance flow. And the decrease in flow region causes the yield stress to increase, which also increases the blood viscosity. So as the blood become more viscous, it have a hard time to flow smoothly. And comparison between the sine and the cosine stenosis, it seems that the decrease in velocity affects the sine stenosis more as the stenosis height increases. Okay. Next, when we increase the arterial inclination to 90 degree, as in figure 5, we can see a almost similar trend in which increase in stenosis height reduces the blood velocity, and the blood flow through the sine stenosed artery is affected more by the increase in stenosis height. However, increasing the arterial inclination from 0 degree to 90 degree increases the overall blood velocity, and the blood flow velocity is being accelerated by the gravity as the artery is inclined towards the vertical position. Next is the effect of time parameter on the blood velocity. We can see that here in figure 6, as the time increases, the velocity increases. And we can note that the increase in velocity at the beginning is high, and as the time increases, the increase slows down. And after a certain time point, the velocity will reach a steady state. Not to mention, higher stenosis height reduce the increase in velocity as time increases. So when the inclination is increased to 90 degree, as the time increases, the blood velocity also increases. And we can see a high increase in velocity at the starting at the starting of the time, and then the increase slows down after some time. And higher arterial inclination amplify the increase in velocity as time increases. And last, the effect of stenosis height and the arterial inclination on the steady dispersion function. So we can see here in figure 8, as the stenosis height increases, the steady dispersion function decreases. The flow region decrease causes increase in yield stress, which in turn increases the blood viscosity. So when the blood is viscous, solids cannot flow smoothly within the blood medium. And the decrease in dispersion function due to the increase in stenosis height affects the sine stenosis more compared to the cosine stenosis. And when the artery is inclined from previously 45 degree to 90 degree, as the stenosis height increase, the steady dispersion function also decreases. The dispersion through a sine stenosed artery is affected more by the increase in stenosis height. So the increase of arterial inclination from 45 to 90 degree increases the overall dispersion function. And this is due to the gravitational acceleration helps the dispersion of solute along the artery as the artery inclines toward a vertical position. Okay, next is the conclusion. So, firstly, the increase in stenosis height decreases the blood velocity and dispersion function. Second, increase in arterial inclination increases the blood flow and the steady dispersion function. And thirdly, the decrease in blood velocity and dispersion function due to the increase in stenosis height affects the artery with sine stenosis more compared to the cosine stenosis. So that's all from me. Thank you.